Okay, so we decided to do our topic on cerebral palsy with the physical therapy approach. So how physical therapy kind of helps people with this diagnosis, what the treatment looks like, and kind of a little bit of a background on the diagnosis. So my name is Analysa.
My name is Lillie.
And I'm Kevin. So we'll get started with what CP actually is. So cerebral palsy, or CP for short, is a varying group of disorders that have a negative effect on a person's ability to move, maintain proper balance, and maintain upright posture. CP is one of the most common motor disabilities present in childhood or infancy. The cerebral part corresponds with association with the brain, while palsy, the word palsy relates to weakness, atrophy, or other issues with using muscles. So symptoms of CP can differ from one individual to another. A person with a severe case of CP might utilize special equipment in order to be able to walk, or might not have the coordination to walk at all. On the other hand, someone with a milder case of CP might have the capability to walk, albeit a bit awkwardly, yet with no additional assistance required. So the symptoms associated with CP do not typically worsen over a person's lifetime, though the severity of already present symptoms can sometimes adjust depending on his or her lifestyle. So uh, possible causes for CP. So there are potential causes of CP that are usually derived from abnormal development of a person's brain or possible damage to a currently developing brain that can then affect an infant's capability of controlling his or her muscles. So the brain damage that can lead to a diagnosis of CP can happen before or during birth, or even slightly after, within 30 days of a child being born, or even during the first few years of a child's life while brain development is still occurring. A small percentage of cerebral palsy is caused by brain damage that occurs after more than 28 days since birth, which is called acquired CP. The usual association is due to head injury or infection, such as meningitis. Other causes include encephalitis during infancy, child abuse, stroke, heart defects, or sickle cell disease. Brain damage that happens before or during birth is called congenital CP. 85 to 90% of confirmed CP cases are congenital, although the specific cause is oftentimes unknown. Risk factors that indicate possible diagnosis of CP include a low birth weight, being less than 5.5 pounds, premature birth, being born prior to the 37th week of pregnancy, as well as multiple births being part of twins or triplets. So concerning the types of cerebral palsy, there are four main types, those being spastic, dyskinetic, ataxic, or mixed. So spastic CP is by far the most common version of the diagnosis, seeing as how it affects approximately 80% of people who have cerebral palsy. Individuals who suffer from spastic CP usually have increased muscle tone, meaning that their muscles are incredibly stiff, which results in very awkward movements. Spastic CP is usually categorized into subcategories based on what part of the body is affected. So the most severe of which would be spastic quadriplegia or quadriparesis. It's the most severe case of spastic CP. It affects all four appendages, the core, the trunk, as well as the person's face. So individuals who suffer from spastic quadriplegia oftentimes can't walk at all and have a variety of other disabilities with their development, such as seizures, vision issues, hearing issues, speech problems, as well as an intellectual disability. Um, Apart from that, the next type of spastic CP would be spastic hemiplegia or spastic hemiparesis. And that's a type of spastic CP that only affects one side of a person's body, oftentimes the upper extremity as opposed to the lower, so there's a bias. The next type of spastic CP would be spastic diplegia or spastic diparesis. And that's the type of spastic CP that induces muscle stiffness in mainly the lower extremities as opposed to the upper. So in some cases, the bilateral upper extremities are not affected at all. So individuals suffering from spastic diplegia oftentimes have the difficulty ambulating due to tight hip, knee, and ankle muscles, and that causes their legs to pull inwards, which is referred to in the physical therapy community as a scissoring gait pattern. So the second type of CP is known as dyskinetic cerebral palsy. That includes problems with the manipulation or coordination of movements of both the upper and lower extremities, which results in difficulty sitting and walking, real basic tasks. So the individual often has uncontrollable movements, such as that are described as rapid and jerky or as slow and writhing. So sometimes the person's tongue and face are affected as well, and the person has a difficult time speaking, swallowing, or sucking on a straw. So another common symptom of dyskinetic CP would be muscle tone that changes throughout a single day or amongst a span of multiple days, ranging from being too loose or too tight, and vice versa. So they'll very much have the tendency to fluctuate between the two extremities. So the third type of CP would be ataxic cerebral palsy that involves having problems with balance and coordination. So the person suffering from ataxic CP will more than likely have constant unsteadiness upon ambulating. More complex movements that involve fine motor control, such as writing, are usually pretty difficult to accomplish due to the increased cadence and speed of that movement. So reaching for something is usually pretty difficult as well, seeing as how their sense of the person's sense of equilibrium is not fully intact; it's very impaired. And the fourth and final type of CP would be mixed cerebral palsy. That basically just involves an individual that suffers from more than one type of CP at one time. So the most common type of association would be classified as spastic dyskinetic CP. That involves symptoms from both spastic CP as well as dyskinetic CP, respectively. So in terms of screening and diagnosis, CP in general is a very complicated disability and can be real difficult to diagnose. So a doctor might suspect the presence of CP in a baby or an infant if he or she has tight or floppy muscle tone. They have a display of unusual postures, or they exemplify slow motor development. There are three main focuses in regards to the diagnosing of cerebral palsy, those being developmental monitoring, developmental screening, and developmental and medical evaluations. So developmental screening, sometimes called surveillance, is when a child's growth and development is tracked over time from when they're born. So if there's any sort of concerns over the child's development, they're to be raised during this monitoring period, which then results in the developmental screening a developmental screening test to be administered as soon as possible. So subsequently, the developmental screening is when a child is given a short test in order to observe any sort of specific developmental delays, such as movement or fine motor control deficits. If the results of said screening are concerning to the person administering them, then the doctor is going to need to make a referral for developmental and medical evaluations. So developmental and medical evaluation is to be administered in order to diagnose a specific type of disorder that a child may have. The doctor is going to take a close look at motor skills, tone, reflexes, posture, as well as the observance of the medical history of the parents. So finding common CP symptoms such as seizures and vision problems, hearing problems, speech issues is very important to pinpoint in order to further ensure the child's safety going forward. So there's possible brain imaging tests such as CT scans or MRIs that could possibly be suggested based on prior results of the evaluation, meaning that so in a nutshell, the sooner that a child is able to get diagnosed with CP, the safer it's going to be for their quality for the child and the family, and the more improved upon the quality of life is going to be. So going on treatment, I'll let Analysa take over.
Thank you. So there are several types of treatment that could be used depending on the severity of the condition, and these treatments can be used in conjunction or by themselves. So the first one is physical therapy. So this is like exercises that can be used for muscle strengthening, balance, movement, and it can also help with other skills such as sitting, walking, or wheelchair use. So we can teach somebody how to transfer from a wheelchair or transfer from a bed to a wheelchair, different stuff like that. Occupational therapy focuses more on activities of daily living. So this is actually extremely important for these individuals because it teaches them skills such as getting dressed, brushing their teeth, stuff like that. Speech therapy focuses on speech, of course, as well as swallowing issues and different forms of communication. So if this individual can't speak or they're having a hard time, the speech therapist can teach them other forms such as sign language. It's pretty cool. Additionally, orthotic devices can be used. Braces, splints, and other postural devices are often implemented for these patients who need that little bit of extra help. Assistive devices such as communication machines that speech therapists would come in and help teach how to use, and special footwear. So I know LeBron James has shoes that he's come out with to help kids and adults with CP. Medication can also be given, especially for those who are epileptic and who have very tight muscles and contractions. The muscle relaxers help with that. Surgery is not often used, but if it needs to be, it can be. It's used for very severe muscle symptoms. So if somebody has very tightly contracted muscles or an abnormal structure, the doctor will often order surgery to help kind of relieve that. Physical therapy is a big part of this diagnosis. So there's many different approaches to target the symptoms and deficiencies that are caused. So exercise is the big thing, getting these patients moving, improving that muscle tone and strengthening. Posture is big also, in walking. We want these patients up and walking and moving. Modalities can be implemented as well. So that is your electrical stimulation, which can help with the musculature as well as nerve stimulation and whatnot. So goals and functional outcomes for these patients, there's no cure for CP. So we're not looking to completely cure these individuals, but we want to help them improve and regain as much functionality as possible. So the biggest thing is pain relief. We don't want these patients to be in pain. We want to help them with that, and we don't want to cause pain. So if we see that there's pain during the exercise, we're going to kind of hold back a little bit, but a lot of it is for that pain relief, so they're not tight and they don't have those contractions, muscle contractions. Cardiorespiratory fitness, we want them to have some kind of endurance to keep going and make sure that they will be able to go throughout the day exercising and movement. Flexibility and joint range of motion, we want to make sure that they're able to go within full range of whatever body part. Mobility and controlled mobility, we want them mobile, moving, walking, stuff like that. Stability a lot of times is core stability. We want to make sure they have that trunk stability so they can sit, they can stand. And independence, that's the biggest thing. We want individuals diagnosed to have that independence, to be able to take care of themselves and live on their own. As I mentioned earlier with occupational therapy, we want them to be able to dress themselves, brush their teeth. If they have a dish to wash, we want them to be able to do that without needing anybody to help them. For adults, we try and treat the patient as early as possible. Like as soon as they're diagnosed, we want them in therapy, but it can continue into adulthood. So to help with that functionality. The treatment may include, but is not limited to, management of pain, use of equipment. So if they're given any orthotic devices, assistive devices, we want to show them how to use it properly so they don't hurt themselves. Adaptation to environmental changes for home and work. That goes back to independence. If something changes at home, if something changes in their workplace, we want them to overcome any obstacles that they face and be able to say, okay, I can do this, no problem, let's get it done. Energy conservation, we want them to use their energy smartly, to know when to expend more and whatnot. So this is an example of an actor who was in a pretty popular show, Breaking Bad. He played the son with CP. So in the picture on the left, you can see him in his assistive devices. And on the right, he's fully functional. He's riding a skateboard. He has that stability, that mobility. So it kind of shows that if you're diagnosed with this, it's not as debilitating as you may think. you still have, with physical therapy, you can overcome the diagnosis. So I'm going to pass it to Lillie.
Oh, awesome. Well, my name is Lillie, and I completely agree with that because early diagnosis in regards for children with CP is a major factor in how they go ahead and go about their treatments that we touched on earlier today. Now, the most accurate way to go ahead and try and diagnose CP within children is by using an MRI. However, as Kevin mentioned, it is very hard to diagnose. And most of the time, if we aren't able to diagnose it accurately, the child is just labeled as a high risk for cerebral palsy. Now, along with the other treatment options that the child may have, which is the physical therapy, the occupational therapy, and the speech therapy, they do also have other ways that they can try and develop their skills. Mainly the one we are focused on is walking. You know, they are a child, so they don't need to necessarily know how to do a lot of other things because the basic is just walking. So we do try and focus on that a little bit more. And if you notice that there is treadmill training, of course, with that, it does encourage that ability. Now, there is another treatment option that has actually grown to more prevalence. It's called hippotherapy. If you want to switch to that. There we go. Okay, hippotherapy, which is it's used in all fields with the physical, occupational, and speech therapy because it utilizes the natural gait of the movement of the horse to provide motor and that provides motor and sensory input. So obviously, when you're riding a horse, if you haven't ridden a horse, there's a lot that's going on. So you have to try and maintain your balance. You know, make sure your grip is good on everything, and make sure that you're paying attention and are taking your not just your visual cues, but your auditory cues to make sure that you stay on the horse, because horses are huge, and if you fall off, it hurts. Now, the reasons that you want to go ahead and use this because during those ambulatory activities that you are on a horse, with the rhythmic doing with the rhythmic movement, which stimulates the anterior and posterior swinging motions. Again, those definitely do promote stability within for the child. So improvements in the balance of the child with CP. So we found that improvements in balance in children with CP does promote participation and quality of life with this particular type of therapy because of all the things that it does promote within its own self. You don't need multiple different types of therapies like the separate therapies that are, physical, occupational, and speech versus just going ahead, getting them involved. And not only that, it has been shown in studies that children respond more to and develop their skills much better when they are in a ambulatory with ambulatory tasks, as well as for recreational tasks, and mainly tasks that they tend to initiate with the supporting family around them. So as the sooner that we can diagnose the condition, the better. That way we can go ahead and get the treatments that they need, so that way they can go ahead and hopefully be able to become, developed adults that can be independent of any type of support if need be.
So we just added a couple of pictures just to show what that looks like. We all kind of agreed on this topic because it's something that we think that we'll see in the field of physical therapy. All three of us plan on going into that realm. So it was something that is pretty common, a pretty common diagnosis that's seen. I think going through this, it kind of shows, yes, there are some factors that can be debilitating, but for the most part, with rehab and hard work, you can overcome it, and it doesn't have to stop you completely. You can still be highly functional. And so I think that's it. Here are our references. And thank you very much.